These are patients waiting for health services which they're not receiving. Tonight, we begin with the paralysis and human suffering in public hospitals today as the health workers' strike kicked off in various parts of the country. Nurses and clinical officers downed their tools, citing prolonged neglect and unresolved labor issues. Dorcas Wangira now reports on the impact of the industrial action, the suffering of patients left unattended, and the unavoidable death of one nurse in the very facility that she spent years working in.
At the Bungoma County Referral Hospital, patients seeking medical attention left in agony and a state of helplessness. Some who had come from as far as Mount Elgon in the Malaba border, all without anyone to attend to them, left. Day one of the nurses and clinical officers' strike, which kicked off midnight Monday. We find patients lying helpless in bed, some relatives preferring to seek treatment in private healthcare facilities.
Na sasa huku Bungoma nimeona imeshindikana na nimeona daktari wapo mkomo.
Mimi ninaumia lakini inaonekana nitarudi nyumbani na nimeharibu fare na ninarudi kwa nyumba kama sijatibiwa.
One nurse from Sirisia died at the County Referral Hospital after she collapsed in her home and was rushed to the facility. However, the family has said that she didn't die because of lack of treatment at the same facility.
She started at home. On the way we came, even praying to God that God may sustain her life, but it couldn't work. But reaching here, I cannot say we were neglected.
In other hospitals in Webuye, Kimilili, Kapsokwony, Chwele and Bumula, operations were normal with patients being treated and attended to. The county government now pleading with the health workers on strike to go back to work.
Tunapoendelea kuandaa kwamba tujadiliane kama county government, wauguzi wetu warudi kwenye kazini. Pia maisha sio rahisi wakati watu wanapoteza wapendwa wao.
In Kajiado County, patients endure harrowing experiences without the critical care provided by clinical officers and nurses. Benches are vacant. There's no activity going on. In Nandi County, 850 healthcare workers in public health facilities maintain they will not go back to work until the government addresses their demands. In Migori, residents now expressing fears of tough times ahead. In Nyamira, nurses and clinical officers stayed at home. According to the Kenya Union of Clinical Officers Nyamira branch, other cadres like farm techs, lab techs and nutritionists are joining the strike tomorrow, Tuesday.
We are requesting for PPEs. How can you front your soldiers without empowering them with weapons?
Punda amechoka.
Yeah.
Na kama punda amechoka mpaka apumzishwe.
At the Mbagathi County Hospital, it's the same portrait of anguish for patients. Even if doctors reported for duty, they cannot function without the healthcare workers at the first line of defense, responsible for triage, assessment before the doctor's diagnosis, and the essential care provided for by nurses. The nurses and clinical officers unions maintain that the strike will go on for as long as their demands are not met. The unions were in a meeting with the Ministry of Labour, but a deal is yet to be brokered. The key demands include the payment of risk allowances, provision of PPE, addressing the pay gap and what they see as discrimination at work, and the establishment of a health service commission to structure employment and labour issues.
And this is what we are saying, that we can no longer take this rhetoric. Health workers have been neglected. And that is why we are saying we are not the ones on strike.
We are not going to commit suicide. If we are not provided with the right protective equipment, we are not going to agree to work because we cannot continue exposing our families and our patients.
We as nurses who take care of patients will not be given a risk allowance. We have talked about and we have discussed and negotiated with the government for the last 3 months. It has fallen into deaf ears. We will not go back to work.
Health experts fear that a strike of this magnitude at the time of the pandemic is bound to have a devastating impact countrywide. An ailing healthcare system could ultimately reverse the gains Kenya has made since the onset of the pandemic in March.
Doctors may have suspended their strike for 14 days, but there's still no reprieve for patients seeking for healthcare in public health facilities such as the Mbagathi County Hospital here in Nairobi. Dorcas Wangira, Citizen TV, Nairobi.